Hi, welcome to Working Smarter.
Working smarter.
Working smarter.
Working smarter.
I've been all around VillageMD.
From the fine city of Houston to New Hampshire and everywhere in between.
I've seen the great work
our people are doing.
It's such an incredible,
Exciting.
Fantastic time to be at VillageMD.
Hi, welcome to Working Smarter. I'm Wendy Rubis, General Counsel at VillageMD, and today I'm so pleased to be joined by Dr. David Carpenter. Dr. Carpenter, how are you?
It's a great morning.
So, let's just start for those listeners who may not know you. Why don't you tell us a little bit about yourself?
I grew up in a small town called Humble, Texas, on the north side of Houston. And back when I was a kid in the 60s, there were just two doctors in the city. And they were both family doctors, and I got to know them kind of on a personal basis. And so I knew I was going to be a doctor early on.
Is that right? So where are you practicing now, and how did you come to know VillageMD?
So I went to Texas A&M University, graduated from there, finished my medical school training in Texas, and came back to Humble in 1979.
Wow, and been there ever since?
And been there ever since.
That's incredible. And what made you choose primary care? Was it these physicians who inspired you early in your life?
I would think so. It was an early on relationship. You know, back then the doctor had a small clinic, 2 or 3 offices, and you just felt that hometown sense of growing up.
What do you think is changing the most, or what's the most different since you've been practicing?
Well, when I went to school, you were going to be a family practice doctor, and now you're a PCP, and I don't know quite what that means yet.
Right. Yeah, what's the difference, right?
Well, I think the difference was back in those early days when I started my practice. You saw the patient, you saw Aunt Minnie, you saw Uncle Ted, and the patients were able to pick you rather than being directed by an insurance company.
Right. And so today it's much different. And how are you coping with, or what's helping you withstand these changes?
Well, I think we all have to adapt with the times. And that's why I looked into Village Family Medicine. Because even though I'm a group of about 7 providers, the ability to be able to be out there on your own, those days are leaving us quickly.
What do you think is different about patients today?
I think in the past, the patients came to see you and they had a level of trust that was almost inherent. And now I still think trust is important, but it takes time to develop that. And the problem now is patients are being redirected almost annually to a different insurance company, a different employer. Our population is more mobile. So doctors are facing more than just the patient contact. They're facing the changing environment.
Yeah, right. And it takes several contacts to really get to know a patient and really understand, how they're doing, don't you think?
Well, I think what happens is once that patient realizes that medicine, it's tangible. When they come in, they actually know that I'm working in their behalf, and they can feel it. If they go to a medical provider and they don't feel that doctor is taking care of them, then you won't get them back.
So tell me, what are you excited about? What do you see coming that you think is going to be great?
Well, the patient care part, that has stayed pretty much consistent. In 40 years, those patients, they want me to listen, and that's probably the most important thing I can do. It's not that hard to be the doctor. It is that hard to listen because we tend to rush things too much.
Sure, yeah.
And we live in a time where, before, you'd see a patient and, again, that relationship was developed over time. And now it seems like you have less time for that patient.
How do you stay motivated? How do you stay energized about the practice?
For me, it was something that I've always wanted to be, and it's in me, and I think it's in most doctors that's what they want to be. It's part of their core fiber, because I think if you're not people-oriented, you're sure not going to do primary care.
So tell me, why did you join VillageMD?
So I've been out in practice on my own for almost 40 years.
Wow.
And the practice has grown from a one-man clinic to, again, 7 providers. And what we're seeing is that the sophistication, what you have to be able to do just to see that patient. Patients don't know it, but what a doctor has to be able to do to verify insurance, to make sure that patient is scheduled, just getting them in the door, much less to see the doctor. I mean, there's a lot to that.
Yeah.
And so I joined Village because I could see that the future of healthcare is pretty much the vision, or my vision became clear when I listened to Dr. Fields.
Yeah.
And when he talks about the value of and the quality that healthcare needs to be a competitor, because there's so much competition. You've got minute clinics and all these other clinics and big medicine now. You've got big groups like in Houston, Memorial has formed their own group and hospital groups. So how does a small family practice clinic participate? And Village has given me that opportunity to participate with healthcare in the Houston community.
That's great. And it sounds like you think things are going well with Village. You're glad you did it.
I've been with Village now 8 months, which is really
Okay.
a pretty short time.
Yeah.
But the vision has stayed constant, and that's to provide value-based care, something that the patients can feel.
Yeah.
And then they will feel the quality of care.
Yeah, so true. So true. So we're going to turn the conversation. We have another special guest, so this is like a double treat. We have Mrs. Joanne Carpenter, Dr. Carpenter's wife. And Joanne, thank you so much for joining us today. How are you?
I'm wonderful. Thank you for asking.
So tell us a little bit about what it's like and what you've seen. He was sharing how he's been practicing for so many years. What have you seen and the changes in him?
Well, like he said, he went into medicine knowing that's what he wanted to do for a long, long time. He's answering truthfully about it being part of him. His nickname is Doc, so he really is a doctor. I mean,
all the way through and
that's
through.
what makes him happy and what fulfills him. So, but as a wife, you have to understand that, and you have to remember when we get calls in the middle of the night or there's emergencies or whatever, he still is a doctor first. And you can't be a dependent woman. You have to be independent and look at life as, you take the good with the bad, and it's more good than bad. And so you think about the patient. If it was your mother or your child or whatever that was sick, how would you feel?
Well, that's really a great point and a good perspective. Have you seen a change? What is your observation?
Tremendously. I remember, back in the day of paper charts and stuff.
Sure.
I mean, before he would be worried about his patients or concerned. Now he comes home. He still is about his patients, but the other discussions about the health insurance, the payers,
the red tape,
the
all
rules,
the red tape,
the regulations, and you got to do this and you got to do that, and we got to hire this and we got to have this different computer system and everything. They say that the electronic medical records are going to make it more cost effective. No, that's not true. But it's part of medicine, and you move on and you take the good with the bad. And again, he loves being a doctor, so that's why it's worth it.
Good. Well, that sounds fantastic. And thank you so much for joining us here on Working Smarter. You guys both helped us get smarter, and would hope to have you both back whenever you can, just to share with us how things are going and how you're doing.
We appreciate what Village is doing for us. We really do.
That's so great to hear. Thank you so much.
Thank you to our sponsor, VillageMD. We hope you will join us for future concise compliance conversations.